Tonight, we continue our commitment to informing you as much as possible about COVID-19. Chad Mira with our sister station KNWA sat down with a local doctor getting answers to your questions.
Dr. Gary Berner joining us once again from Community Clinic NWA. Dr. Berner, how are you doing today?
Doing well. Having a busy day here at Community Clinic, but doing well. How about you?
We are well as well. I'm sure another busy day for you all in the healthcare field. We want to start with some new testing recommendations we heard today from Governor Asa Hutchinson during his daily briefing. The state now recommending anybody, no matter the age, who is showing symptoms of COVID-19 to get tested. So the big question we have now is, do facilities like yours have enough tests to accommodate that new recommendation?
That is a big question. Yeah, I just heard that recommendation as well, probably within the last half hour. So we're going to have to kind of, look at our supplies, really do a deep dive of, okay, if we start increasing the amount of tests we do, how quickly will we run out? How quickly can we get in new supplies? What supplies are available? So we're going to have to change our process again. This is we're getting pretty good at changing our process at this point. As new recommendations come out, we're having to adjust. So this will just be another step that we do. Probably can have a better answer for you tomorrow. But Dr. Nate Smith from the Department of Health, the governor, have done a good job in leading us this far, and that's what they're recommending. We'll certainly do our best to follow that.
Certainly a time where we all need to have a little flexibility. I want to talk to you a little bit about treatment options. There have been some clinical trials going on and some promising results, too, for a drug called remdesivir. Of course, we've talked about hydroxychloroquine in the past as well. Have you heard any new information about possible treatment options for COVID-19?
In terms, I've heard the same reports. In terms of anything definitive, in terms of anything that's been, done widespread, nothing really new that's incredibly promising. But yeah, I have heard some of those new reports. A lot of it is promising. A lot of it has been done in small environments with specific patients. So it's tough to then take that small scenario and start to look at a broader scale and start to look at your milder cases. Say a 70-year-old with COPD that is feeling bad from coronavirus. COPD is a lung disease that's feeling bad, but not yet hospital sick, not yet in the ICU. Those then are where we really need to take these next step, is when can we start to take care of our more everyday patient with coronavirus that's sick, but not in the hospital or not in the ICU. So that'll be really interesting when that next level of testing can start to look at a broader scale.
Mostly tonight, this week, we now know there have been over 200 healthcare workers in the state who have come down with COVID-19. Does this get to a point where we start to worry about a shortage of these types of employees?
So I think that's a constant worry. It's anxiety for myself and my family, and anxiety for anyone that's being asked to work in that type of environment. Right now, I don't believe that there's a critical shortage. We certainly have the folks that are direct care workers with patients with coronavirus getting sick. As we said, 200 employees across the state. That being said, there is a significant amount of healthcare workers that are actually not employed right now, or not necessarily have been laid off, but maybe have been furloughed or a kind of a temporary delay. So we do have a big reserve as well that's maybe not been working, and potentially some of those folks can step in and cover some of those shifts if more and more folks get sick. So it's something we'll have to keep a really close eye on. It's certainly a concern, and I feel for anybody that's been that directly affected by coronavirus. My understanding across the state is that we're not at any sort of critical shortage, but it's something being definitely actively monitored.
That's all we have for you tonight, Dr. Berner. We appreciate your time, and as always, stay safe over there.